The third thing I think about the future is the whole issue about new providers in the system. We are going to have a much more freed up system in terms of provision. Let's not get too carried away. It's not going to go overnight, but nevertheless, there are going to be new providers coming into the system. And I think we should, as certainly someone in the NHS 30 years, I welcome that, because one of the things about new providers, and the evidence really shows this across the world, is that new providers bring in innovation with them. One of the best and quickest ways of getting innovation into a system is to bring new providers, new niche providers, sometimes small scale, sometimes large scale, into the system to make it happen. So a system which encourages, enables people to do that seems to be much more likely to make it happen. And the final way in which it makes it much more likely is essentially necessity. We didn't say quality, innovation, productivity and prevention by accident. Innovation is the thing that holds it all together. As you go round the stands, and I've already been round a number of the stands, there are hundreds and hundreds of ideas to improve quality and improve productivity and save resource for the NHS to be reinvested. We haven't always had the necessity to do that. We've always, certainly over the last 8 or 9 years, we've always had growth to buy off some of the problems that we face. We just simply haven't got that opportunity now. So necessity, I think, is going to drive innovation in the system as a whole. Which kind of finally brings me back to kind of why we're here, the improvement of quality and outcomes for our patients. And the NHS is a unique healthcare system in the world. It has the potential to be even better than it is now, even better, significantly better in lots of ways. But holding on to that idea of a system which is tax-funded, free at the point of use, is a really important part of that. Because what we can do out of that, we give our population, our patients, that peace of mind that many people in the world simply don't have because they don't have a system like ours. And it's very important, I think, as we go through those changes, we hold on to that basic principle. It's the thing that the population supports, it's the thing that our staff supports, it's absolutely consistent with the values of our people. So really important that we hold on to that. And we increasingly need to see the NHS not as a healthcare system which takes away taxpayers' money, which in a sense we should be grateful for the taxpayers' money that we get. We increasingly can see the NHS as an engine for economic change and wealth creation in the country. The development of our life sciences industry, in particular our pharmaceutical industry, is inextricably linked with the NHS. And the unique selling point of the NHS as an integrated system where we have huge amounts of information about our patients, where you can build really world-class research and development and all the things that go around with that, is very, very important. I'm very optimistic about the future. Heavens, it's going to be tough. We always knew that it would be tough. Any kind of healthcare system, and indeed we're not the only healthcare system, as you know, in the world tackling the kind of massive issues that we are doing. But it seems to me we are uniquely placed to be able to take this forward. And I think with the right partnerships between the public and private sector, getting and supporting the energy of the people, the clinicians, the frontline people in our services, and focusing our attention absolutely on the interests and needs, quality and outcomes of service for our patients is the way forward. I'm genuinely looking forward to the future, although it's going to be tough. I am sure we can make the NHS something that really the whole of the people who work within it, the whole of the people who we're partner with, and the whole of the population can be enormously proud of. Thank you.
David, thanks very much indeed. We'll take some questions in just a moment, but a few from me first. You talked about the rubber really hitting the road now. Can you say where you are on that journey and whether there will come a point in 2 years, 3 years' time where you will pause and say, right, okay, we're just taking a breather here to let everything settle in, or is it a constant process of change from now on that we're talking about?
Yeah, there will be no pause. You know, even if I was to sit here and say we should have one, the system, the expectations of our patients, the technology, the financial arrangements in the country simply won't allow us to take that pause. So it is, in a sense, continuous change for us as we go forward. And one of the things I think about the way we need to design the system as we take that forward is it needs to be as flexible as it possibly can. I mean, one of the issues I think, which is I guess obvious at one level, but in the jargon, outcomes and quality is systemic. What that means is that you can't improve. You can have the greatest surgeon in the world, but they won't get the best outcomes if the whole system is not working together. And that's health, social care, housing, independent sector, the whole. If the whole system doesn't work together, you simply won't get the best outcome for patients. And those issues are moving. Different parts of the healthcare system and social care system are moving at different speeds at the moment. So getting something that's flexible, that can adapt as we go forward, I think is really important. But I think a change is continuous. But we can do it well or we can do it badly, and part of my job is to do it as well as we possibly can.
Okay, and you talked about new providers bringing innovation with them. A lot of new potential providers out here. What is the process? How is the NHS Commissioning Board going to function? Is it going to be really easy for them to pitch to you, or is there quite a complicated process to go through?
Well, I think the first thing that I would say, the people who will drive the change will be the consortia. So, I mean, there is no shortcut to that, in the sense of any provider needs to talk to consortia. They need to talk to them, they need to be involved with them, they need to engage with them, they need to get to understand what their needs and requirements their requirements are. What we can do as a commissioning board is take a good idea or be I mean, one of the things that many new providers say is that that's all very well, but we could literally spend our whole lives going from one place to another just trying to do it. The commissioning board gives you a national focus where it will be possible to pitch things to, which will be an enabler in a sense for consortia to take things on and make them change. So we can play a role in that, but we won't be the only role. If the first thing you do is host the commissioning board, it won't work. You need to make your pitch to the consortia and then come to the commissioning board, and we can help and support people take it forward when individual consortia have got the idea.
So nobody should really go to you first and ask you to then feed it down to the consortia? Apart
from those people who want to make a pitch around the major regional and national specialist services that we will commission directly. There'll be absolute opportunities there to make, so that the paediatric cardiac surgery, all of those kinds of things that we will commission directly. That is you can absolutely pitch to those. That's about £20 billion worth of activity. You can and will be able to pitch to the commissioning board once we've got up and running. At the moment, it's only me. There is nobody else.
How large is it going to be? You're recruiting, presumably, as you speak.
I'm getting bigger as I sit here. The commissioning board itself, we've got as I say, for the running cost of the system as a whole, we're moving from 5.1 billion to 3.4 billion. The commissioning board itself the financial envelope that we've been given to run it is about £400 million. So that is a significant organisation. That is not a kind of small organisation by any stretch of the imagination. About 2/3 of that will be focusing on the direct commissioning. So on GP commissioning, dental commissioning, optometry commissioning, but also the regional commissioning. So it's about, as I say, £400 million. It's a significant organisation. Okay.